Welcome, everyone, and good afternoon. Thank you for joining the National Caucus and Center on Black Aging, NCBA, and Dr. Sharon Reynolds for our webinar again today on addressing glaucoma in older adults, causes, effects, and treatment. Our presenter, as I mentioned before, Dr. Cheryl A. Reynolds, is a professor at the Nova Southeastern University College of Optometry. She was past president of the National Optometric Foundation, NOF. She is a planning group member of the NEI, which is the National Institutes of Health, NEI, National Eye Health Education Program, NEHEP, and is co-chair of NEHEP Eye Health, My Health campaign that fosters eye health for African Americans. Dr. Reynolds, I turn it over to you. The floor is yours. Thank you.
So much. I want to again say thank you to the wonderful staff, you, Angela, Ms. Support, for inviting me. Again, I want to apologize. Last week we had some technical difficulties, but I appreciate being here again to talk to you about glaucoma. And it's so important to talk about this condition because, again, it impacts our African American communities or underrepresented communities or Hispanic communities a little bit more so than other communities, and we'll touch on that. And more importantly, January, the beginning of the year, as we start off 2025, is Glaucoma Awareness Month. So it's a fitting month to talk about this condition. And as mentioned, I'm going to be talking about the causes of glaucoma, the signs and symptoms of glaucoma, how do you detect glaucoma, and how do you treat glaucoma. And, I'm going to talk for not all the time. I think I have about 45 minutes, 50 minutes or so, but I want to leave more of the time for the audience to answer their concerns, questions about this condition. Again, these were all my credentials that were mentioned earlier. And again, I'm just so happy to be invited. I do want to promote the NEI, National Eye Health Education Program. This program was established many years ago just to promote eye health. To the public, it's so important to understand that losing your vision has such an impact in our quality of life. And there are the diseases and conditions that we can detect early and preserve our patients' sight and increase their quality of life. We have information when it comes to diabetes and how it impacts the eyes. We have information on glaucoma, which is what we're going to talk about today. We have information in Spanish for those that speak Spanish. We have information on vision and aging, as well as information on how certain condition can disproportionately impact minority communities with our eye health, my health, and how these conditions impact African Americans. So I always like to start my webinar, if you've seen most of these, with that I've done before, with some simple questions. And the questions are, the first question is, do you or anyone in your family have glaucoma? And you guys can put in the chat box and I'll have Miss Angela come on and let me know what people put in the chat box. Or do you just know anyone? It could be a cousin, it could be an aunt, it could be a friend that has glaucoma. So let's see what's going on in the chat box.
Yeah, one yes. So we are, and I'm sure they're getting ready to just type in and say and answer the question.
I'm pretty sure a majority of the audience member knows someone that have glaucoma or have a family member that has glaucoma. So let's dive into this disease about glaucoma. And what I want to leave you with today is 5 things that you should know about this condition. And the first one, the first question that is often asked by my patients a lot of time, Doctor, you're telling me I have glaucoma. What is glaucoma? It is one of the leading causes of blindness in the world. It's only second to cataracts. So a lot of people lose their vision from glaucoma. It's a chronic degenerative disease that affects the nerve in the eye. So as we talk about the nerve in the eye, I always like to describe it to my patients in simple, relatable terms. The nerve in your eye, or structure in the back of your eye, when you get a dilated, comprehensive eye exam, and we look at the back of your eye, has a shape like a donut or maybe a bagel, where there's a center hole and then there is the dough around the donut and bagel. That dough represents nerve tissue. So if you look at where this pointer is, you see this donut, you see the center part of the donut. And if you look at this schematic next to it, this is a nerve in the back of the eyes, or the nerve tissue. So you can see that here this patient has healthy nerve tissue, or this schematic represents healthy nerve tissue. So you have quite a bit of dough around the small center of the donut. But in some patients, whether it's pressure in the eye, and pressure in the eye, I describe it to my patients like bathtub of water. The body constantly, or the eye constantly, is making a fluid called aqueous. Just like if you turn on the tap, the water's constantly running. But then there's a drainage system that's open, so you don't get a backup or buildup from that fluid that's constantly being made. And what happens in the eye, that fluid is being made, it gives the eye its shape. But in some patients, there could be a blockage in the drainage system, so that fluid builds up and it can cause pressure on the back of the eye and affect this optic nerve, or this structure that looks like a donut. And when it does, it like a little rat eating out the center of the donut. It gets bigger and bigger and bigger and bigger over time, and then eventually there's no more donuts, they're just crumbs. Well, in glaucoma, that center gets bigger and bigger over time, as you can see in this schematic, and you can see here it's really big, and there's not enough nerve tissue in the body, and that's when patients are completely blind from glaucoma. And what's really important to take away from this is that glaucoma causes irreversible, irreversible loss of vision or blindness. You cannot get it back once your vision has been impacted from glaucoma. So I have a video. I'm going to try to play this video so that it kind of gives an overview, a little bit of what I just mentioned about glaucoma. So let's see if this video plays.
So let's say you have to read an incredibly long email from your boss that you have to finish before the big meeting starts.
Let's see here if we can find.
In 10 minutes. Or you're cramming for an exam the night before, but can't bear to keep your eyes open to read one more textbook chapter. Or you're reviewing a dense legal document that could change your life forever.
Glaucoma usually.
Or you're proofreading your latest one last time before you submit it to make sure there aren't any errors. No matter what you have to read, we could all use a second pair of eyes to help us retain information and put our...
Okay, sometimes there's technical difficulties, but we play with
But
that.
can occur when there is normal eye pressure as well.
So we'll restart this video, but this video
Glaucoma
really
usually
kind of
occurs
explains it.
when there is an increase in pressure in the eye, but can occur when there is normal eye pressure as well. This pressure causes damage to the optic nerve, leading to decrease in peripheral vision and potentially blindness. Your eye is divided into two chambers, the anterior chamber at the front of the eye and the posterior chamber at the back. A fluid called the aqueous humor is produced by the ciliary body and circulates between the two chambers to clean and nourish your eye. Once it reaches the edge of your iris, it leaves the eye through an opening called the trabecular meshwork. In some forms of glaucoma, more fluid can be produced than is removed. This leads to an increase in pressure in the anterior chamber. Eventually, the pressure throughout the eye increases and exerts force on the neural fibers of the optic nerve. Over time, this damages the optic nerve, leading to irreversible vision loss. There are a number of risk factors for glaucoma, including age, ethnicity, family history, and medical history. Early detection through regular comprehensive eye exams with an optometrist or ophthalmologist is key in preventing vision loss in those with glaucoma.
So basically, that schematic that I just played really kind of highlights glaucoma and what I mentioned about this condition. And one of the things that was noted is age, ethnicity are some of the risk factors for glaucoma. So the next question about glaucoma, who's at higher risk? Yes, ethnicity really is important. Studies after studies have shown that minority patients, African American patients, our Hispanic patients are more at risk of developing glaucoma. So we, this group that's on this call today, are more at risk for developing glaucoma. So it's important that we get a dilated comprehensive eye exam. We talked about age. But one of the things that I want everyone to know about glaucoma is that for us as African Americans, 60, yes, for others, but the disease tends to start earlier in our population of patients, typically at age 40. And not only is the disease starting early in African American patients, but it also progresses faster in African American patients. Therefore, it's so critical that patients that have glaucoma or have been told that they have a high eye pressures or patients that have a family history of glaucoma get a annual comprehensive dilated eye exam. Glaucoma is 5 times more common in our communities, and blindness from glaucoma is 8 times more likely to occur, more common. We all not only get the disease earlier at a younger age, 40, it also it progresses much faster, and it is one of the significant causes of vision loss, in our community. And also too, if you have a family history, it's just so important because you carry the genetic profile to get this disease. And also, if you have diabetes, I talk about diabetes a lot. We know that patients that have diabetes, there's a 40% chance of developing glaucoma. 40% of patients will have glaucoma. So if you have diabetes, yes, you are at risk of developing glaucoma. Now, what's important to note about glaucoma, am I going to have any symptoms from this disease? You know, I see fine. I don't have glaucoma. You can see 20/20, perfectly good vision, and have glaucoma because as the disease is affecting the nerve, it's causing you to lose your side vision. So a lot of times patients don't notice that their side vision is impacted until the disease is too late. And some of the things you will see in patients that have limited peripheral field or side vision is that they're bumping into the doors or bumping into things because they cannot see to their side. And eventually, as the disease progresses, it causes you to have like a tunnel sort of vision, and then that is lost. And that's when people are blind for glaucoma. So it's important, we call it the silent thief of vision because there's no early signs. You're not going to have eye pain. You're not going to have floaters and flashes. You're not going to have red eyes. And in the early signs, you may even not even notice visual field loss. We want to catch it before there's visual field loss. The only way to really detect this condition, as I said before, is with a dilated comprehensive eye exam. Blindness is irreversible once you get glaucoma, and therefore early detection is critical. And this is really the symptomology. Again, here's a normal vision. You can see everything. As the disease progresses, it starts to, you lose your ability to have side vision or your peripheral vision. You have what appears to be tunnel vision. And then eventually that is lost as the disease progresses. So how is glaucoma treated? So my doctor says, you know, Mr. Jones, you have glaucoma. You need to be treated. And glaucoma can be treated with eye drops. when your eye doctor prescribes these eye drops, you need to use them as directed. It could be once a day, it could be twice a day. Sometimes patients are on multiple eye drops, just like you're on multiple blood pressure and diabetes medication to make sure that we control the pressure in the eye. In some patients, laser treatment might be an option, or they may have to have laser treatment to help because the topical eye drops aren't working. And then for those that have advanced disease and that we can't get the pressure lower, then they may need eye surgery. So, how do you know you have glaucoma? Because it's important to know that you have glaucoma. A lot of people don't know that they have glaucoma. 50% of patients walking around with glaucoma don't even know they have the disease. And as I mentioned, it's the silent thief of vision. And the only way to know is with a comprehensive, dilated eye exam. You can't just go and get a basic exam without them looking at the back of your eyes. You can't just get your pressure checked, and that's going to tell you have glaucoma. Although we know pressure is a risk factor, you have to have a dilated, comprehensive eye exam. So, as we talk about January is Glaucoma Awareness Month, and we make New Year's resolution. You want to make a New Year's resolution to make eye health an important part of the new year. So, get your comprehensive dilated eye exam. These are all the resources that are available. More information can be found on the NEI, Glaucoma Awareness Month resource page, as well as some other eye condition. We're going to share this PowerPoint so you have your resources. Also, outreach resources, get free or low cost eye exam for those that have financial barriers to care. You can look up some resources here as well. And this information will be available for you. I know that Angela will share this information. And then how you can connect with the NEI and social media just to learn more about these eye conditions. And now the most important part of this webinar is being available to you to answer all your questions. So Miss Angie and Miss Angela, you guys can share any questions that are in the chat box.
Thank you, Dr. Reynolds, for joining us. Thank you very much. Great and thoughtful presentation as always. We have quite a few questions in the chat, and so I'm going to read them to you. The first question asks, is there data that addresses the reasons why African Americans have a higher prevalence of glaucoma?
So there have been multiple studies that have looked at the demographic and the ethnic component to this condition. The thought process is, again, is maybe due to high blood pressure is disproportionately more prevalent in our African American communities, and it could be part of that in the sense that during that slave trade, it was part of West Africa that we come from, our ancestors come from, could be a part of that. In the Barbados Eye Study, which looked at the prevalence of this disease, we just found that disproportionately more patients were impacted from the condition that came from a certain component or a certain part of Africa during the slave trade. So that could be, again, why. Again, some things that have happened as that whole process happened with slave trade, with our kidneys and changes in our kidneys and things of that nature is why we are, as minority communities, African American communities, disproportionately more impacted from the disease. And that kind of goes to the genetic part of glaucoma.
Okay. So building on that, Dr. Reynolds, many of us don't know our family histories, or we have older parents that might not share their medical history.
And
And so how do we address that when going into our ophthalmologist or optometrist and requesting, when you fill out that those questions about your family history, you may not know. So how do you address that and get quality eye health care?
So I think the really important thing that I want the audience to understand is one of the risk factors for developing glaucoma, unfortunately, is race. So if I see patients that are of African American descent, Afro-Caribbean descent in my chair, and I see elevated eye pressures and I see changes in their optic nerve head, just because of who they are, I am a little bit more inclined to really, really educate them on the follow-up care and more testing that is needed to rule out glaucoma. So for those patients, I do kind of look at who's in my chair. I do ask about family history. A lot of times you may not know that your family history have your family members in or family history or genetic profile. But if you have a family member that went blind, there's different reasons why your family member may have gone blind, and one of those could be glaucoma. So those are other questions that we can ask as well. Or the other thing is, a lot of our patients may not know that their family members have glaucoma, but they've seen family members use eye drops in their eyes. So there's other ways that we can ask to measure or to ascertain better if the patient has some sort of genetic component to this condition.
Okay. Okay, and then this is my own personal question. My dad has glaucoma, severe glaucoma, and I have a cabinet full of eye drops, very expensive eye drops. Is there a way for those of us, or families, or patients, to get less expensive eye drops?
So that is why I wanted to provide the resources. These medication and treatment can be a bit costly for our patients and can interfere with compliance and interfere with care. It impacts a lot of times the patient's like, I feel fine, I see fine, I'm not going to use those drops. Or those drops are exactly what you said, Miss Angie. They're too expensive. I'm not going to use those drops. So if you find that you're having challenges getting the drops that's recommended by your eye care practitioner because of the expense, some companies do have patient assistance program. You may talk to your eye care practitioner about, can I get this drop through patient assistance program? Can you help me in that way? And or is there a less expensive as effective medication? And maybe your eye care practitioner will prescribe something that's a little bit more cost effective for you.
Okay, thank you very much, and I'll share that with my dad. The next question in the chat asks, what are floaters and where do they come from?
So floaters are, the best way to describe the eyes, a shape of a basketball, right? So when we look at a basketball or a tennis ball, what we see in those things are is air. So air fills up the basketball or the football. In the eye, the shape of the eye is because of a fluid or component called the vitreous. It's a gel-like structure in the eye, keeps the eye, the shape that it is. It's mostly made up of water, but there's a little bit of collagen to it. And so over time, especially as you grow up, there's changes in that vitreous. And I equate it to like jello. When the jello is ready to be eaten, it's uniform and homogeneous through and through. But if you leave that jello on the counter and come back in an hour, it's a consistency of liquid and solid. Well, as we all grow up, that gel changes in consistency. So sometimes you can see a more condensed collagen fibril where it's more condensed. And if you look up, it moves a little bit, and that's what causes the floater. That's a normal age appropriate floater. Sometimes when a patient gets hit in the eye or have eye trauma, you can get pigment or changes and more floaters or complaint of floaters from a retinal detachment. Flashes of light can occur when you have a retinal detachment or you have an acute sort of floater onset. So, anytime you have any symptomology of flashes of light or floaters and you didn't have it before, it's so important that you get a comprehensive dilated eye exam so we can better ascertain if it's just a normal age appropriate floater or if there's any sort of holes or tears or defects in the retina.
Thank you, Dr. Reynolds. Dr. Reynolds, you mentioned comprehensive, us getting a comprehensive dilated eye exam. Does private insurance, Medicare and Medicaid pay for those exams? And do they pay for them annually or might they pay for them several times during the year?
So most of your insurances will pay for a comprehensive eye exam, a yearly comprehensive eye exam. If you are at any time diagnosed with diabetic retinopathy or there's bleeding in the back of the eyes from your diabetes. If you're diagnosed with glaucoma, then the insurance will pay, some insurances will pay, or most insurances will pay for, close monitoring every 3 months, every 6 month monitoring, or a medical visit for the treatment of these eye conditions, whether you need laser treatment, injection in the eye, for your glaucoma, the testing that is necessary to make sure that your visual field is intact and that the disease is not progressing as much, the insurances will pay for. So that's more medical eye care for patients.
Okay, thank you. Our next question asks, are there any lifestyle changes that can help manage glaucoma? And if I may, part two to that, do vitamins help?
So there have been some studies that have looked at eye-friendly vitamins and nutrition in support of glaucoma. And what I tell my patients is some of those studies may be inconclusive, but I am a proponent of saying eating healthy is important. You minimize oxidative damage to the eye, to the optic nerve. We know that studies have shown that lutein and zeaxanthin are good to help minimize oxidative damage to the eye. So I do recommend that my patients eat healthy. In some cases, take multivitamins that may include lutein and zeaxanthin. If they have eye condition, we did macular degeneration. A multi-center study showed that taking eye-friendly vitamins, or AREDS, the age-related eye disease study, to supplementation that has lutein and zeaxanthin can help, minimize or decrease the worsening to macular degeneration. So I'm a proponent of eating healthy, taking eye-friendly vitamins, of fruits such as strawberries, blueberries. They're a good source of antioxidant and they help to minimize oxidative damage to the eye.
And if I can build on that a little bit, does stress or can stress factor into our eye health?
Yes, I always tell my patients it can affect your eyes and stress can affect your body. And so, if patients are really stressed out, it can lead to elevated blood pressure. It can lead to worsening of their diabetes. Their A1C numbers could be higher. It can lead to other inflammatory changes that can also impact their eye health and can cause their glaucoma to progress.
Okay, and then one more to that. What about these devices that we are tethered to? Do those devices cause any stress on the eye and
Well,
might exacerbate glaucoma?
There have been some studies that looked at, your iPad and your iPhone emitting low levels of light, and can these low levels of light be damaging to the eye? And some studies are back and forth. But what I will say when patients ask about devices is that devices you want to minimize your time on device. These devices are good, but we don't want to be on them for hours. You're staring at them. Patients tend to have drier eyes because you're staring at the monitor a little bit more so than you could. We know that kids during the pandemic, more cases of nearsightedness occurred because of this. And nearsightedness can also lead to eye damage. Pathological myopia can also occur. And then also, too, we know that, staring at this, you're not sleeping as well as you could. It can disrupt your sleep pattern that can lead to inflammation. So there's a couple of cascades of problems that can occur with some of these devices, just being on the devices a long time. So really moderation is the key.
Okay, thank you. Our chat asks, or it says, my grandfather went blind from glaucoma. I was screened a few years ago. It said I was okay. Can the risk increase over the years?
Yes, as I mentioned earlier, age is an important risk factor for developing glaucoma. We know that patients with glaucoma, African Americans tend to have an early age of onset. But if you had a comprehensive eye exam and your eye pressures were okay, normal, and patients always ask, what is normal eye pressure? Some patients can have elevated eye pressure, Miss Angie. You go to the doctor and your eye pressure could be high, but you don't have glaucoma. You have a condition what we call ocular hypertension, which can put you at risk for developing glaucoma. So a lot of times doctors might want to treat the eye pressure because it's too high. Some patients with normal pressures, when I say normal, your eye pressure is different from blood pressure. So when you go to the eye doctor, they're going to check the pressure in your eye. As I mentioned about the fluid in the eye that's constantly being made, if the drainage system is not working properly, the pressure will go up a little bit more in the eye. So anything that's a 20 or above is a little bit concerning, but you can have glaucoma at 15 pressure. You can have glaucoma at 10 pressure. So again, that's just one risk factor for developing glaucoma. Your eye doctor will do additional testing, a visual field test to see what your field test looks like, to see if you have any impact in your side vision. Your eye doctor should also take pictures of your nerve to, so that you can see what's going on with your optic nerve in the back of the eye, as well as treat you with topical eye drop to lower the eye pressure. And like I mentioned earlier, you can lower those eye pressure with one drop, or you can lower the eye pressure with 2 to 3 drops. That's why some patients with glaucoma are on combination drops and other drops to really get the eye pressure to a good goal to minimize progression. I give a talk on glaucoma quite a bit, and I tell my patients this. Once you're diagnosed with glaucoma, Miss Angie, you're on this highway. There's no getting off this highway. The destination is blindness. And I tell my patients, you don't have to reach that destination. My goal as your eye care practitioner is to slow you down. No one has to go blind from glaucoma. If they utilize their drops, they're following up with their doctor for follow-up care, and just making sure that they're doing everything right. One of the reasons that patients sometimes have progression, severe progression, is not utilizing the drops as prescribed because I feel fine. Oh, I see good. Yes, for now, but the disease is a progressive disease. The other thing is making sure that you're seeing your doctor on a follow-up case. Your doctors are going to want to see you every 3 months, every 4 months, to make sure that they're doing tests to see the disease stage and check for progression. So follow up with your doctor as recommended. See your doctor every 3 months, every 4 months, to make sure that you're having your checking for progression. So utilizing the drop, checking for progression, seeing your doctors. These are the ways that we slow down the disease. And one of the biggest way is early detection. Early detection is only possible with a yearly comprehensive eye exam. And if you go into your doctor and say you have a little bit of sign or your pressure could be a little bit elevated, you want to make sure you go back and follow up. Don't wait, don't delay, because the disease can progress if you delay. So making sure that you see your eye doctor, making sure that you're compliant to your medication use, and following up with your management, that's how we can get the disease to crawl to that destination. You don't have to get to that destination. No one needs to be blind from glaucoma. We have so many different ways to treat it. We have new device technologies that are available to us so that we can do early detection and intervene earlier and treat our patients earlier to preserve their sight.
I want to thank you for those remarks, Dr. Reynolds, before we move forward. My father is blind from glaucoma. And just as a comment to the audience, it is hard, very hard on the patient and equally hard on family members. So I again want to thank Dr. Reynolds for joining us this afternoon and for sharing those remarks. Our next question asks, are there any exercises that we can do that might benefit our eye health?
Yes, I say this all the time when I do the diabetes talk. So, studies after studies have shown that just, weight loss, aerobic exercise is really good. What I mean by that is, cardiovascular exercise and, those exercise, walking, going to the gym, losing weight, eating healthy, all those things have a benefit when it comes to your overall health as well as your eye health. So yes, I definitely encourage my patients to exercise, to walk. We know that exercise, aerobic exercise, 3 times a week help decrease your bad cholesterol, right? We want to lower our bad cholesterol and increase our good cholesterol so we can minimize our risk from cardiovascular disease. Eating healthy, those are important. Taking vitamins, in some cases, eye-friendly vitamins, and seeing your doctor, those are all important component to minimizing eye health issues, not just the glaucoma and diabetic retinopathy. If you take care of your diabetes, if you get your A1C under control and you manage your diabetes, you minimize developing diabetic retinopathy and glaucoma, as well as cataracts and potentially blind from diabetes. If you control your autoimmune conditions and even taking medications, I was remiss to mention some medications can put you at higher risk of developing glaucoma. Medications such as steroid, and a lot of patients that have autoimmune disease that are taking steroid, it's important that they get a comprehensive eye exam to make sure they don't have steroid induced glaucoma. So there's two types. There's primary type, and then you have some secondary types of glaucoma. So again, those secondary type of glaucoma can occur due to other things such as taking steroid medications.
Okay, thank you. Our next question in the chat asks, when watching out for holes and floaters, such as symptoms of glaucoma, do they take place at all times, daily, or just occasionally?
So back to the symptoms of glaucoma, I just really want the audience to understand glaucoma has no symptoms. Now, when you have primary open angle glaucoma, which is the most common type of glaucoma, you don't feel anything. You could see 20/20. The floaters are due to aging, yes, but glaucoma, it's robbing you of your vision. That's why we call it the silent thief of vision, and it causes you to lose your side vision, but a lot of patients aren't aware of that. So floaters is totally different. Floaters, I say to my patients, if you have little spots in your vision, again, that could be normal aging, growing up, but you don't know that. You gotta have a comprehensive eye exam to make sure that there's no holes, tears in the retina, that you're not having a retinal detachment, or other eye problems. But it's important to get a comprehensive eye exam to rule those things out. Glaucoma, secondary glaucoma, in some patients might have a type of glaucoma where the drainage system gets so clogged up that the fluid can't drain and it blocks up, and so it causes a painful eye. And those patients will have really elevated eye pressure when they come to see me, and that's because the fluid can't drain out, and that's that angle closure glaucoma. So there are different types of glaucoma, yes, but the most common type and the most prevalent type is the type that just robs you of your sight with no symptoms in the initial condition. And it's only when the disease progresses, patients are bumping into things, maybe bumping into the wall, or saying that they can't see things off to the side.
Yep. Dr. Reynolds, is glaucoma more prevalent in men or women, African American men or women, or is it equal?
It's about equal. I would say that glaucoma, I just want to leave the audience with this one fact. Glaucoma is prevalent in African American communities. And so, yes, men and women, but equally men and women. And it's important that you get a comprehensive dilated eye exam. Last but not least, if you know someone in your family, friends, colleague, anyone that has glaucoma, make sure that they're getting a comprehensive eye exam as well, because sometimes these patients may have been told and didn't go back. And last but not least, no one needs to go blind from glaucoma. The best way to detect it is going to the eye doctor and making sure that they do a dilated eye exam, that they're looking at the optic nerve, that they're measuring the eye pressure in the eye, and that they're following up if they think you're a glaucoma suspect. And a lot of times we'll start off by saying, Mr. Jones, there are changes in your eyes that are suspicious for glaucoma. We need to do additional testing. And that's why they need to do the additional testing.
Okay. Okay. And then I have a question. What is the difference, please, between between an ophthalmologist and an optometrist?
I
And do
know.
both providers offer the same service?
So basically, thank you for asking that. The audience always like to ask. The ophthalmologist is a medical doctor that could be a DO or MD that could do eye surgeries. And so my doctor is that a retinal specialist, cataract surgeon, LASIK surgeon, glaucoma surgeon. Those typically are ophthalmologists, they're MDs. And those are the specialists that we refer to. Optometry, it is a 4-year degree. We get our doctorate in optometry. We can detect eye condition. We prescribe for glasses. We prescribe for contact lenses. We can prescribe antibiotic for some eye infections, and we can treat glaucoma based on state laws. So in most cases, in most states, we can treat glaucoma. When the patient's glaucoma is progressing and need management, that's when we typically co-manage with a glaucoma specialist. That's when the patient may need eye surgery to help to lower the eye pressure in their eyes.
Okay. And then Dr. Reynolds, I have another question here. Are you with us for an hour? Because I want to respect your time here before I invite our audience to keep asking those wonderful questions.
I said it was an hour, but I'm more than happy to stand a little bit longer to answer
Okay.
these very important questions.
Absolutely. So I want to stop right here and ask our audience to keep those questions coming. And in the meantime, I would like to ask, why is it so hard to get an eye appointment? Everybody's booked. And what do we do to get eye appointments?
That's interesting. So, if you're having challenges getting an eye appointment from your provider, or if your insurance is sending you to a certain eye place for an eye appointment, you could try somewhere else. I think that it's good that doctors are booked and busy. It means that patients are really getting their yearly comprehensive eye exam, and they're starting the new year out right and correctly in getting a comprehensive eye exam. So I'm really out for that, right? Because the New Year's resolution is eye health. So if your eye doctor is busy and you're not able to get an appointment, you can try another eye doctor. And again, if you're going to an eye place, commercial could be, my eye doctor could be National Vision, any of these chains, Vision Works, Lens Crafters, optometrists are there. All of us are capable of detecting changes in the eyes and detecting if a patient has glaucoma. They may refer you for further care, but I think the most important thing is the detection of the disease.
Okay. And Dr. Reynolds, it might be just you and I, but I'm going to invite our audience again. But my next question is in terms of concierge health, how might we be able to get, if we don't have concierge health where all of our doctors are in the same suite, regardless of service, how do we get our doctors, including our ophthalmologists and optometrists, on the same page with our other care providers?
So that's really important that you ask, because one of the things that I've stressed in most of these talks and all the time is the communication between the healthcare provider team is so important. For example, if a patient has diabetic retinopathy, it's so critically important that their primary care physician, their endocrinologist is aware. So your eye practitioner should be sending a summary report of the exam, but also too, I would challenge the primary care and the healthcare provider to send, give the patient a referral, as well as let us know what their A1C and blood sugar is. And most doctors do that. They do send me a report to let me know they're referring the patient for an eye exam because the patient has diabetes. And of course, it's important that the eye care practitioner send a report back. If any of you in the audience have diabetes and you go to your eye doctor, just make sure you ask, can I get a note from my treating doctor so that they're aware that you went, number one, and number two, that there's no bleeding or retinopathy signs in the eye. If you have glaucoma, again, it's important your eye care practitioners to send a report to your doctors. If they're going to refer you to a glaucoma specialist, then that's important that there's a letter or communique to the glaucoma specialist, also for the primary care doctor to note if the glaucoma specialist is going to do any surgeries or anything, just to keep the communication amongst the patient's healthcare team open.
Now, Dr. Reynolds, in the case of my dad, when he has to visit an internist or otherwise, I always carry all the eye drops with me.
And
And
that,
and they
and
go,
that
wow. They go, wow.
And
What?
that's important to know.
Yeah.
And one of the things that the patients can do too, Angie, is know their eye drops. If you don't know the name, know the color of the cap. If you
Yes.
tell me you're using a yellow top drop, universally, I know what that medication is. If you tell me you're using a purple top drop, then I know what that medication is for glaucoma. If you're telling me you're using a teal or green, I know what that medication is. So if you don't know the medication name or have challenges knowing the name or pronouncing the name, make sure you A, bring them like you do, Angie, or B, know the cap colors.
And sometimes I take a picture, and that might help our
That's,
audience
that
too.
is awesome
Yeah.
as well. That really helps the doctors.
And our next question asks is, it says, Dr. Reynolds, can you please speak to the ways we can keep our optic nerve healthy? What can we do to lower our own eye pressure?
Sue, this is really a great question. Is there anything that you can do? As you know, I mentioned earlier, eating healthy, those healthy fruits in foods that increase, that minimizes oxidative damage to the eyes. There have been multiple studies that have looked at that. Exercise, just keeping your body healthy. When it comes to the eye pressure, again, as I mentioned earlier, the eye pressure is just one risk factor. The other risk factors that are important is, again, age of the patient, genetics of the patient. Let's say your eye pressure is low. Let's say your eye pressure is 15, but your father has glaucoma. That it can also indicate that you also may have glaucoma. So, yes, keeping the eye pressure low is important, but remember, eye pressure is just one of the risks. Some patients, as I mentioned earlier, have high eye pressures and don't have glaucoma. And so the only way to know this is with a comprehensive eye exam, a dilated eye exam, as well as additional glaucoma testing to rule out glaucoma. So, yes, eating healthy, exercising, making sure that you're doing, taking care of yourself, making sure that you're following your doctor's recommendation and compliance to medication, your systemic medication, keeping your glaucoma, your diabetes and in control, keeping your blood pressure low, your cholesterol, knowing your numbers. Those are really important things in minimizing progression, right? Minimizing progression of the disease. And so, yes, eating healthy, exercising, eating those healthy foods are important. But it's important, again, to get a comprehensive dilated eye exam just to see, make sure that they're detecting your eye pressure and looking at your optic nerve, doing some optic nerve testing, some visual field testing, taking a picture of the back of the eyes, and monitoring you very closely.
And I'm able to walk into my optometrist and have all of those services, even if it's a big box optometrist. Is that
Most
correct?
optometrists have all those services available, and if they don't, they will refer you to a colleague that does.
Okay, okay. We have about 5 minutes more, and respecting Dr. Reynolds' afternoon, I'd like to invite our audience to ask more great questions. More great questions. Well, Dr. Reynolds, I think we've answered all of those great questions. And so I'd like to respect your afternoon and ask you, um, we know we're going to get a comprehensive health exam. We know we're going to do this annually. Any more takeaways? We're going to eat healthy. We're going to exercise. And we're going to encourage our family members to know their history and to share that history with our healthcare providers. Is there any other advice you'd like to leave us with? Any takeaways or any more action items that we need to do to have great eye health?
I think the most important thing again is we're starting off this new year. January is Glaucoma Awareness Month. We want to make sure that everyone know that this silent thief of vision doesn't have to steal the vision, right? The destination is blindness. You don't have to go blind. No one with glaucoma has to go blind. And in fact, if you get a comprehensive eye exam and you follow the prescribed treatment, you take your eye drops, and you follow with your doctors, no one should lose their vision from glaucoma.
Okay. Thank you, Dr. Reynolds. And our last comment in the chat reads, thank you, Dr. Reynolds. Great presentation. Thank you very much. And thank you, Dr. Reynolds, for joining us again this week. Great presentation. Thank you to our audience for joining us again this week. We appreciate your patience. And we look forward to seeing you soon, Dr. Reynolds, and wish everybody a good afternoon.
Thank you. Thank you.
Thank
Everyone.
you. Bye-bye.